This video contains a truth that has changed the lives of many people. If you are having health problems and have ever felt stuck, please subscribe to the channel and leave a comment in the comment section so we can share useful knowledge together. Have you ever sat in a quiet room and felt something wasn't quite right, but couldn't put your finger on it? Maybe it was a flutter in your chest, a dull ache in your back, or a new kind of tiredness you hadn't felt before. You told yourself it's probably nothing, just getting older. But something inside you whispered, what if it's not? Let me tell you something from over 3 decades of caring for people just like you. Those quiet whispers from your body are worth listening to, because catching something early, especially cancer, can be the difference between a small bump in the road and a life-changing journey. And here's the good news, you've got more power than you think. Today, I want to talk with you, not at you, about something deeply important, something that could save your life or the life of someone you love. We're going to look at 3 critical cancer screenings that every person over 60 should know about. These aren't just checkboxes on a medical form. They're tools, powerful, proven tools that help you stay in control of your health, your future, and your peace of mind. Now, before we dive in, I want to invite you to be part of this conversation. If you've ever had concerns about cancer, a past diagnosis, or even questions about your current screenings, share them in the comments below. Your story could help someone else feel less alone, and we'll be there to offer support, encouragement, and guidance. So let's talk about the first screening, one that's often overlooked but absolutely vital. Colon cancer doesn't usually make a dramatic entrance. It's a quiet kind of danger, the kind that builds slowly and silently over years. Maybe you feel a bit bloated more often than usual, or notice a change in your bowel habits. Maybe you chalk it up to your diet or stress. But colon cancer doesn't care about your excuses, and that's exactly why screening matters. The most common and effective screening method is the colonoscopy. Now, I know just hearing the word might make you squirm in your seat. Nobody likes the prep, and yes, it's not exactly a day at the beach. But here's what you might not know. A colonoscopy doesn't just detect cancer. It actually prevents it. How? By finding and removing polyps, small, abnormal growths, before they ever have the chance to turn into cancer. If you're over 60 and you haven't had a colonoscopy in the last 10 years or ever, this is the time. It could mean the difference between needing a minor outpatient procedure and facing months of chemotherapy. And here's another option. If you're unable or unwilling to get a colonoscopy, there are non-invasive stool tests like FIT and Cologuard that can still offer valuable information. Talk to your doctor about what's right for you. But whatever you do, don't ignore it. Let's shift now to something that touches so many families across the country: lung cancer. Even if you've never smoked a day in your life, or you quit decades ago, lung cancer is still something you should have on your radar, especially if you've had any long-term exposure to secondhand smoke or environmental risks. The truth is, lung cancer is often found too late. It's a master of hiding until it's in an advanced stage. But early detection, it changes everything. That's where a low-dose CT scan comes in. It's a simple scan that can spot tiny nodules or changes in your lungs before you even notice a single symptom. Now, this test is especially important if you're between 50 and 80 and have a history of heavy smoking, even if you quit more than 15 years ago. If that's you or someone you love, please don't put this off. The scan is fast, painless, and covered by Medicare and most insurance plans. And if it finds something early, the treatment options are much better, less invasive, more effective, and with a higher chance of full recovery. Think of it like this. Your lungs have carried you through every laugh, every breath of fresh morning air, every long conversation with a friend. Don't they deserve a little attention now? And one more thing, if you're feeling uncertain about whether you qualify, don't guess. Just ask your healthcare provider. It's a quick conversation that could change the course of your life. Before we move on, I want you to take a moment and think. When was the last time you talked to your doctor about cancer screenings? When was the last time you really asked, what should I be checking for at my age? If it's been a while or never, this is your moment. Because the truth is, after 60, your body doesn't bounce back the same way it used to. And while we can't stop aging, we can stop cancer from sneaking up on us. That's what these screenings are for. They don't guarantee you won't get sick, but they give you a fighting chance. They give you time. And time is everything. Now that we've talked about colon cancer and lung cancer, two of the most common but preventable types in older adults, it's time to turn our attention to a third type one that often doesn't show symptoms until it's advanced, and yet can be found early with the right test. Let's talk about prostate cancer, a topic that can make some folks uncomfortable, but one that absolutely needs to be on the table, especially after 60. If you're a man watching this, chances are you've had at least one conversation with your doctor about your prostate. Maybe it was in passing, maybe you brushed it off, or maybe the thought of it just felt a little too personal. But here's what I want you to hear: you're not alone, and you don't have to be afraid of talking about your health. Prostate cancer is one of the most common cancers in men, but when it's caught early, it's also one of the most treatable. That's the key word, early, because like lung and colon cancer, prostate cancer can grow quietly. You might not feel any pain. You might not notice a single change. And yet, without even knowing it, something small could be growing inside you that needs your attention. So what can you do? It starts with a simple blood test called the PSA test, short for prostate-specific antigen. It checks for a protein in your blood that can be higher in men with prostate cancer. Now, the PSA test isn't perfect. Sometimes it shows high levels even when there's no cancer, and sometimes cancer can be present with normal levels. That's why the conversation with your doctor is so important. This isn't about rushing into treatment or jumping to conclusions. It's about knowing your numbers, watching for changes, and building a plan that fits your body, your risks, and your life. If you have a family history of prostate cancer, especially a brother or father who had it, this test becomes even more important. African American men, in particular, are at a higher risk and should consider starting these conversations even earlier. What I always tell my patients is this: it's your body, and your peace of mind matters. You deserve to have all the information. You deserve to make decisions with confidence. The PSA test gives you a window into what's going on inside, quietly, safely, and in time to act if needed. Now let's pause for just a second, because I want to share something from the heart. In my 30 years as a physician, the hardest conversations I've ever had are the ones that started too late. The patient who didn't want to bother their doctor. The man who said, "I feel fine." The woman who thought, "It's probably just aging." And then, one day, it wasn't. But do you know what the most uplifting conversations are? The ones where we caught something early, where we made a plan, where we stood side by side and said, "We've got this." That's why we're having this talk today. Not to scare you, but to empower you. Because knowledge is power, and early action is life-saving. Now, before we move forward, I want to say something important to everyone listening. If you've already had any of these screenings, first of all, thank you. You're already taking care of yourself. And second, don't stop there. Keep the conversation going. These screenings aren't just one and done. They're part of a rhythm, a routine, a commitment to staying ahead of the curve. And if you haven't had these tests yet, or it's been years since your last checkup, that's okay too. The important thing is that you're here now. You're listening. You're thinking about your health. And you have the power to take the next step. Maybe that step is calling your doctor tomorrow to schedule a colonoscopy. Maybe it's asking about a low-dose CT scan for your lungs. Or maybe it's finally getting that PSA test you've been putting off. Whatever it is, make it happen. Not next year. Not when it's more convenient. Now. Because life waits for no one, but it always rewards those who show up for it. And if you're watching this and thinking, "But what if they find something?" Let me tell you this. Finding something early is not a curse, it's a gift. It gives you options. It gives you time. It gives you hope. The people who catch cancer early don't just survive, they often thrive. They beat the odds. They tell their story. They walk their daughters down the aisle. They see their grandchildren grow. They live longer, stronger, and with more gratitude than ever before. So take a deep breath and remember, you are not fragile. You are not powerless. You are not alone. Let's keep going, because there's one more part of this journey we need to walk together, and it's all about taking this knowledge and turning it into action that supports not just your body, but your spirit too. If you've made it this far, let me tell you, you're doing something powerful just by being here. You're not avoiding the hard stuff. You're facing it head on. And for that, I truly applaud you. Now, let's talk about the third screening, one that many people overlook until it's too late: skin cancer checks. It might surprise you that skin cancer is one of the most common cancers in the United States, especially as we age. Years of sun exposure, even from childhood or those summer afternoons in the garden, can silently build up and lead to changes in the skin that turn dangerous over time. And the tricky thing is, many of us just don't think to check. We look in the mirror and notice the wrinkles, the spots, the new little bumps here and there, and we brush them off. Just age spots, we tell ourselves. Nothing serious. But here's the truth. Some of those spots may not be harmless. Some may be early signs of skin cancer, especially melanoma, which is the most dangerous type. Melanoma doesn't always hurt. It doesn't always itch. It doesn't even always stand out. But when caught early, it can be removed with a simple procedure. When missed, it can spread to other parts of the body and become much harder to treat. So how do you stay ahead of it? It starts with regular skin exams, both at home and with a dermatologist. You don't need fancy tools or medical training to look out for yourself. Just a mirror, a little patience, and the courage to pay attention to your body. Check your skin once a month. Look for new moles, changes in existing ones, or spots that bleed, itch, or just look a little different from the rest. A good rule of thumb: if something stands out to you or gives you a bad feeling, don't ignore it. Get it checked. Your back, your scalp, the bottoms of your feet, these are areas we tend to forget, but they matter just as much. And if you live alone or have trouble seeing certain areas, ask a family member or friend for help. It's not about vanity. It's about vigilance. It's about care. And it might just save your life. Dermatologists recommend a professional skin exam at least once a year, especially if you have fair skin, a history of sunburns, or a family history of skin cancer. And if you've ever spent a lot of time outdoors, whether working, fishing, or gardening, that's even more reason to schedule that appointment. I know some of this can sound a little overwhelming. 3 screenings, 3 chances to catch something serious, 3 moments that could change the course of your health. But here's the beautiful part: you are not doing this alone. You have doctors, caregivers, friends, and people like me who are here to walk with you every step of the way. And more importantly, you have time. Time to take action. Time to take control. Time to take care of the body that's carried you through decades of life, love, work, and family. Think of these screenings not as chores or burdens, but as acts of love. Love for yourself. Love for your children who want to keep you around. Love for the life you still have so much left to enjoy. Cancer can be scary, yes, but do you know what's even scarier? Regret. Wishing we had acted sooner. Wishing we had asked that question. Wishing we had made that appointment. Let's not live with regret. Let's live with purpose. I want you to ask yourself today, what's stopping me? Is it fear? Is it worry about what the results might say? Is it the thought of inconvenience or cost? Whatever it is, name it. Say it out loud, and then choose to move forward anyway. Because you are stronger than your fear. You are braver than you think. And you are worth every ounce of effort it takes to protect your health. So take the step. Call your doctor. Put that appointment on the calendar. Tell someone close to you what you're doing. Invite them to join you. Share this video with a friend or neighbor who needs the same reminder. And when you do, come back and leave a comment. Let us know how you're doing. Share your story, not just for yourself, but for someone else who might need the same nudge you got today. Your voice matters. Your experience matters. If you found this video helpful, please tap the like button. It helps more people just like you find the support they need. And don't forget to subscribe. We're building a community here, one that believes in growing older with strength, knowledge, and heart. Because here's the truth: aging isn't a decline. It's an awakening. A chance to pay attention, to care more deeply, and to live more fully. You have a story still unfolding, and every chapter you write from here on out can be brighter, stronger, and healthier than ever. Here's to your courage. Here's to your future. And here's to living your best life at any age. You've got this.